I'll very quickly introduce myself. Nydia Boswell, I'm the VP of Product Management for the platform that y'all have heard a little bit about today, and you are about to hear more about. And I'm joined here by Tony. I'm going to go drive it because it's not as straightforward as slides. So while I do that, Tony, you'll introduce yourself and lead us through this first portion.
Okay, thank you, Nydia. Hi, everybody. My name is Tony DiGiorgio. I get the honor of talking a little bit about kind of what we built and what the symplr operations platform is, as well as a little bit about how. So these have been fantastic conversations and about why we're all here and kind of what we're doing. But I want to talk a little bit about, as Steve puts it all the time, I get to geek out a little bit. So we're going to talk a little bit about kind of what the operations platform is. And if you think about kind of what we're building here with symplr, it's an architectural foundation, right? The fundamental goal of what we're trying to build and what we've been building is a way to not only enable the symplr products and capabilities of what we have, interconnect and talk to one another, but it's about being able to have that interoperability, to be able to have that extensibility within our products as well as yours. So where we started was with the security aspect of it. So security in the forefront of healthcare is number one, always. So we've taken the approach of looking at cybersecurity, threat modeling, user security around centralizing a single access point, all the governance, the compliance. And we've done that in our partnership with AWS. You heard BJ talk about where we're moving with everything, about where we're going with the AWS platform as a whole. So we started there. We started with making sure that everything and anything we build is part of that security infrastructure as a whole. From there, we talked about our infrastructure. So when we started building the platform as a whole, when we started thinking about kind of where we're going and how we're going to do that, we had to make sure of a couple things. And we chose a direction that made sure that as you all grew, we grew with you. So scalability, efficiency, overall being able to disaster recover. If something happens, we want to make sure that we can recover very quickly because, the operation system within a healthcare system has to keep going, and we have to keep going with you. So we worked on making sure that when we built a infrastructure, we did it in a cloud-based model so we can scale, we can recover, and we can advance everything that we do in a very, very speedy way, okay? So that's kind of the foundation of where we started. From there, then, what we started to do is we started building services, right? The commonality. We wanted everything within the symplr ecosystem to function in the same manner. The way we stored documents, the way we stored data, the way we protected that data, the way we manage users. You heard BJ earlier talk about the symplr platform, right? Well, our goal is to make sure that when you log into any symplr product, you're logging into symplr, right? That's fundamentally all we want you to do. You're going to log in once. We're going to secure you once, and we're going to make sure that now you have the capabilities to access anything within symplr at any given time. So we worked through building those services to make sure that as you do that, you're getting that common look and feel, right? Everything within the symplr product base, the symplr platform as a whole, looks the same, right? All the integrations, all the capabilities that you have, it functions in the same manner. And it's really important because we want you to be using symplr, not a symplr product. We want you to be using symplr in that regard. So we started there. We built an entire ecosystem of services that will enable us to build faster, right? So as we build the ecosystem of the symplr services, we can grow fast. We can go really, really fast in terms of being able to innovate in that manner, okay? Now, when we talk about a lot of those pieces, we talk about all the connections, right? We talk about API, being API first, right? So many of you right now probably have systems that are dealing with a lot of flat file integrations, right? I mean, typically everything that you're doing when you're dealing with a product, you're doing a flat file integration somehow, some way. We've moved that. We've moved that model to a API first driven methodology. And by doing that, we've made sure that everything that we do within the healthcare system is considered real time, right? So anytime we're integrating with you, anytime we're integrating with our own products, we're doing that in a real time manner with our APIs. And part of that has been our connections. Everyone here has the EHR. Everyone here has the ERP system. You're using Workday. You're using Epic. Well, we built a centralized model where you don't have to integrate those products, those systems with every single one of our capabilities. We do it once. Within our standardized platform service, now what we do is when we integrate with your EHR, your Epic system, your Cerner system, when we integrate with your Workday systems, you do it once. And by doing that now, we can actually send that data out to all of our products, all of our capabilities in one standardized manner, which means now we can get value to you faster, right? We can bring that to the forefront of whatever system you're using within symplr, we can bring that forward quickly. It also enables us to extend. One of the important things about, excuse me, the symplr model is that it's not just about interconnecting and the interoperability within symplr products, it's the interoperability and the extensibility within your own products as well. With so many different systems that you guys have to manage, our goal is to be able to enable you to extend those on top of our platform in a seamless manner. So with our APIs, with our connectors that we have within the EHRs, the ERPs, and so forth, we enable you to connect with that. So we built a set of products, a set of services that enable that within things like events and so forth. So when something happens behind the scenes within symplr, we can notify you. We can actually send downstream system events to your own systems that allow you to connect and run your own workflows, run your own type of BI analytics as it may be within those systems, right? So as we move forward with that kind of model, it's enabling us to not only communicate within our systems, it's enabling you to take action upon that. One of the most important things that we've always done as we think about how we're building our products and we think about how we're going to enable these is we look at all the data that we have, we look at all the services that we have, and we think about, well, now what? And that's fundamentally why we built the kind of connections and the APIs that we had. Because when you think about the way our products function, we think about the way all the data that we have functions, it's not just about giving you reports and so forth. It's about giving you that now what. What can you do with this data? How can you take action with all of this? And that's what these connections are about. So from there, we're going to dig into the data. So as you can imagine, with all the different capabilities of symplr and all the different products and everything else that we have, the amount of data that we have is unprecedented. No one else has the kind of data that we have. So what we had to do with that is turn it into something actionable, turn it into a platform. So what we have is we have what we call the symplr data platform. I don't really like to call it a warehouse because a warehouse is kind of, to me, seems like a place where data goes and dies. You run analytics on top of it, you run a report on top of it, and then you can't do anything with it. What we've actually built is a data platform, something that you can actually start taking action upon. You can actually do something with. This data is leveraged as part of our product base. Our products can talk to this platform. Our products can interact with this platform. Our products can send events to your when we see certain things happen. And you're going to hear Nydia talk a little bit about some of the use cases and kind of why that's going to be important to you. Because now we can actually do something with that data. The next step of that wasn't just about the ability to see your data based on the capabilities you have. It's about building that bigger governance model, right? About being able to see that whole enterprise view of all of your data. So as you have more and more capabilities within symplr, you have more and more views of that data within symplr as well, all in one spot, right? So instead of having databases and other kind of data areas of the symplr data that you have across your entire ecosystem, you have it in one place. So we've now pulled all of that together, and we've given you that one standardized look in that regard. So as you have that your own BI tool, you can connect to that, right? It's not just using symplr tools, it's not just about using symplr capabilities. It's about being able to extend and leverage whatever tooling you also have. Okay, so from there now, we take it one extra step. So if you think about all the data that we have, we talked a little bit about AI. There's been some conversations around AI and everything else. It's the biggest thing, right? symplr has taken a very, I'll say, proactive approach at AI. We've also taken a very authentic view at AI, right? We're not going just to go. We're not just going to say, let's go throw ChatGPT on top of something. We're doing it in a way that makes sure that we leverage this data in a way that is going to provide the efficiency, the value to all of you. So as you think about what we've built and the data platform as we have as a whole, fundamentally now what we have the capability of doing is building AI on top of all of that in one standardized model, right? So instead of individual capabilities within AI, we can actually look at AI and look at all of your data and provide value to you in a way that no one else really can, right? In a way that allows us to look at your spend data in alignment with your contract data, your workforce data in alignment with your access data, and all of that as one. So as we start building our AI models, as we start leveraging all of the different data elements that we have, we can provide AI in a way that will make it more valuable to you, make it more efficient for you as you go, okay? So I appreciate your time. I'm going to step off. I'm going to hand it to Nydia. Nydia is going to walk you through one of the use cases that we had that actually utilizes all of these services. There you go.
All right, thank you, Tony. Now that we know what the platform is, let's talk about that application of it. I love what BJ and Dr. Chaudhry said earlier about it's about the people, it's about the pain points that they have, and what are the outcomes we can deliver to make people's lives easier. So we're going to tell a story about physician onboarding. And I don't know if y'all are like a lot of the organizations that we've heard and spoken to about this, where there's some fragmentation today, there's some delays, there's maybe not the best experience for the providers as they're coming on board. I won't make you raise your hands or anything to identify, but just think if this is something that resonates with you, if this sounds familiar. So we've got Dr. Smith here. And Dr. Smith is a newly hired physician, and she's experiencing this, having to provide her information to multiple people at the same organization at different times, really just wanting to get on the floor to practice, but not being able to because of the delays here. So with the symplr operations platform, we can tie our solutions together to help, as BJ so eloquently put it, remove some waste from the process and drive some efficiencies here. So it starts with the recruiting process. It'll flow through credentialing, right? Very glamorous credentialing. And then to the patient-facing directory and physician scheduling, right? There's more that could fit in here as well. You could think the physician contracts and speeding up that process. The required learning, being able to more quickly administer that, get that set up so that the provider can hit the floor. But for the sake of simplicity, we'll go through kind of these 4 steps in the process today. So starting with physician recruiting. So we've got a product called symplr Recruiting. And in that, we have the physician recruiter who's doing the initial intake of demographic information for this provider, Dr. Smith. And they're entering this information usually on behalf of the physician. And moving through the interview process, ultimately the organization decides that they do want to move forward in hiring Dr. Smith. And then the physician recruiter kind of does their normal statusing, dispositioning of the provider. And because we're leveraging the platform services that Tony spoke about, we can then automatically send that information over to the credentialing team in symplr Provider. So the credentialer gets the information. I'll let Tony click through here. So the credentialing team gets the information from the recruiting system automatically. They don't have to re-enter it, ask the physician again. And then they don't have that lag time for that handoff. Instead, that's done automatically, so the credentialer can come in here, start doing the processing that they need to do, and ultimately, the credentialing gets completed. And then there's another opportunity for automation leveraging the platform, where the platform can then send the information over to the patient-facing directory. It's important that that gets pulled from the source of truth and that that is accurate in order to meet compliance and regulatory needs there. So we can show that same provider information now on the patient-facing directory so patients can find providers. At the same time, once the credentialing is complete, Beyond sending it to directory, we can also send it to physician scheduling. And the scheduler receives an automatic notification that there's a new provider that needs to get on the schedule. And they can take action, get the provider on the schedule sooner. Again, because that's been automated, there's not that manual handoff and reentry of information anymore. And the provider, Dr. Smith, now can get on the floor sooner and seeing patients sooner because of the symplr operations platform and the automation that we can provide for these workflows. So that's one example. BJ mentioned a few earlier, including this physician offboarding one, where we've got information on the physician in more than just the products that we talked about earlier. We've also got their contract information in symplr contracts, so we can see when a contract is expired. We've got quality information in Midas status, so we can see if there's some performance trends that need to be investigated further. We've got information in compliance, where we can see where maybe there's a policy that needs to be signed off. And in all of these, maybe the physician should be removed from the schedule, so we can have that communication to that product. Maybe at the time, maybe because of a number of different reasons, a physician needs to be offboarded. So we can remove them from all these systems here, from the patient-facing directory. We want compliance with the No Surprises Act there. And we can make that easier. And even, as BJ mentioned, sending it to the EHR to make sure that all the systems that need to know about this know about it more quickly and efficiently, rather than having to manually contact all these different functions and roles. So that's another example with just the physician life cycle and physician offboarding, where we can make these connections across our product to, again, remove that waste from administrative tasks today, right? Ultimately, freeing up time to be able to deliver patient care, maybe to reinvest, rather than just spending the time on these tasks, getting that time back to do more strategic, more high-value work. BJ talked about some other examples as well. I know we've got some supply chain folks in the room, so there's also an integration that we're working on to connect value analysis more quickly to contracting, or a lot of CNOs in the room as well, opportunity when somebody badges in to take that information and send it to our clinical communications tool so that nurses and other staff can be set up for that role-based communication more accurately, more quickly, right? So tons of opportunity here. We know that there's more, and I liked what, I believe it was Dr. Supal said earlier today, that it's all about listening and engaging with your stakeholders. And we've heard so much from y'all today. We know that y'all are thought leaders in what you do. And so we're here to listen and learn over the rest of today, tomorrow, and even beyond. We want to hear from you if you see ideas and opportunities where there's pain points, and we can help you achieve your goals with less friction by connecting the different functions here. Please come find us. Let's engage so we can transform healthcare operations. Thank you.